Hi students, let's start our new topic, Hospital Planning and Operations Management for MBA first year, first semester, Block 3 Operations Planning IP Services. So here we'll be today we'll be dealing about Unit 8 ICU Services Part 1. So let's see what are the ICU services, the definition, functions, and types of ICUs. Okay. Definitions. So intensive care unit, ICU is nothing but intensive care unit, which is again a part of inpatient services. So intensive care unit is a special medical treatment area in which a patient who is very seriously sick or critically ill is kept under constant observation, typically in a dedicated department of a hospital. So why the patients are kept? Because they are very critically ill, so that they need more care and monitoring and observation. Okay. ICU is one organized system for a provision of care to this type of critically ill patients, where the intensive and specialized medical and nursing services are provided for these patients, so that they have the enhanced capacity, where in these areas they have that monitoring and multiple modalities of physiological sign support of the patient is available, okay, to sustain life of the patient during a period of severe life threatening diseases or life threatening critical illness. Okay. In these areas, that is because of high modality supplies, lot of observation equipment that is available, the patients are treated because of their illness or critical illness. Okay. So here the ICU is highly specified, sophisticated area in the hospital, and they have a designed or designated specialized staff, and also there is an equipment with advanced technology, and these are completely there available for management of the critically ill patients. Okay. So if you see the functions, what are the functions of ICU services in the hospital? So the ICU, as I mentioned, intensive care unit, is again a unit within the inpatient of the hospital, as defined to treat or manage very critically ill patients where the condition is reversible. That means, if you provide that critical care for the patient, the different life threatening diseases or conditions of the patient, if you provide care on time and with continuous observation and management, the condition can be reversible, and this the restrainment of the health can be restored. Okay. And this critical illness is not a gender specific, it is not age specific, and it is not any disease specific, but it can be for any of the multiple factors. Okay. So which requires an extra efforts from the hospital staff or the doctors or clinical care providers to monitor the patient, continuously observe them, provide the services. Okay. So it has a nursing unit within the intensive care, where a lot of monitoring, a continuous monitoring with active life support systems, especially for where the nurses are treated or skilled or trained to provide this specialized care for such patients. Okay. And they also have that technical expertise and sophisticated equipment, and where this allows the nurses or other care providers to aid them in providing such critical care. Okay. And each ICU provides a close observation, and which is done by the skilled nurses. So the nurses who are there in the ICU are very skilled, and they have trained specially to handle such critical conditions. Okay. And these highly skilled professionals, like either the physicians, or provide a specialized treatment. Okay. Depending upon the patient conditions, there might be loss of conscious patient, how to tackle them. There might be a patient who met with an accident or a lot of bleeding, so how to tackle such patients. These are different clinical conditions and problems that are available, that are there for the patients. Each provider or the nurse are trained and professionally trained to manage such conditions. Okay. And these patients are monitored closely, like every nurse, like if we have seen in the inpatient wards section, So, where we have 1:1 nurse ratio, one patient, one nurse in the very critical patient. So, each nurse is capable of that special trained and needs a continuous observation, and the nurse observes the patient and monitors everything and documents and provides an update to the providers and treats the patient. Okay. So, let us see what are the different types of ICUs that can be available in a hospital setup. So, one is a normal ICU, it is nothing but the intensive care unit, which implies that any critical patient can be kept into that intensive care unit based upon the equipment or other resources available within the ICU. So, the other ICUs like are ICCU, which is an intensive coronary care unit, which is coronary means nothing but related to heart. Any issues that are life threatening for the patient are resulting out of some cardiac problems or heart problems. So, these patients are put into ICCUs. SICU is another unit, intensive critical unit, where the patients who undergo surgery, maybe after surgery the patients are moved to SICU for monitoring purposes, how they are recovering from the surgery, recovering from the anesthesia effect, and all these such type of conditions can be monitored and treated in SICU. And MICU, medical intensive care unit, all the medical problems, critical medical illnesses that the patients develop. So, all those patients are kept under MICU. NICU is neonatal intensive care unit, all the newborn babies who needs more further monitoring because of certain conditions during their birth. So, they are put into neonatal intensive care unit and they are taken care. And other one is PICU, pediatric care unit, all the infants and children who develop certain critical illnesses over the period are put into the pediatric intensive care unit. And also we have other specialized ICUs like burns ICU, where all the burns, patients who sustained burns and also are critical illness that will, and also are critical, like not minor burns, who are very critical, have severe burns and they have life threatening conditions. So, they are put into a special burns ICU, where a lot of critical care and lot of monitoring, observation, specialized treatment is given to these patients. Similarly, obstetric ICU, all the women having obstetric problems, life threatening problems are put into ICUs. And neuro ICU, patients having some neurological derailments, critical illnesses coming out of that neurological diseases are put into neuro ICUs. So, every hospital can have either all of these depending upon the size of the hospital or level of the hospital, or few of these in combination can be there in the hospitals. Okay. Now, let us see the types of ICUs based on protocol of admission, like how the patient is coming into the hospital, and based upon that how the ICUs can be classified. Okay. So, the patient there are three types like open, closed and transitional ICUs. So, first category, open ICU, is an ICU or an area, critical care area, where specialty teams have full admitting rights. The team working there have they can take a decision of whether to admit a patient or not. Okay. And the consultant or intensivist, the main care provider is just provides the consulting services, like he checks the patient, he says okay, this is the treatment and please continue with this treatment. The consultant places request for orders, laboratory investigation, diagnostic services, that is it. The decision of admitting the patient is completely taken by the specialty teams that are working within the open ICU. Okay. And a closed ICU is one where the intensivist is the admitting medical officer. It is the quite opposite to the open type of ICU, where the intensivist has all the rights reserved whether to admit a patient or not into the ICU, and the specialty teams collaborate with the staff. Okay. The specialty teams will collaborate with the ICU staff, the nurses within the ICU, they will be coordinating with the specialty teams to understand the condition of the patient, give the prognosis or the updates of related to the patient. Okay. The third type is a transitional one, where you can combine both open and closed, and this is nothing but a model in which involves a mandatory consultation situation before getting admitted, where the specialty teams might still have admitting privileges to the ICU, but every patient must be seen by the intensivist before getting admitted into the ICU. Okay. An alternative is a model where some of the ICU beds are allotted as closed and others are as open. So, this is called be a transitional. Okay. Thank you students for listening. Thank you.